Abscess causes, symptoms, diagnosis, and treatment. An abscess is an acute infection that occurs when bacteria invade the body and cause pus to accumulate in the tissues. Pus is a thick, yellowish fluid that contains dead white blood cells, bacteria, and toxins. Causes of abscesses. Abscesses can occur anywhere in the body, but they are most common in the skin and soft tissues, especially in areas that are injured or infected. Some common causes of abscesses include: causes of abscesses. Skin infections. Bacteria enter the body through open wounds, bites, scratches, or areas of skin damaged by skin conditions such as boils or impetigo. Dental infections. Bacteria from an infected tooth can spread to the jawbone and cause a dental abscess. Causes of abscesses. Ear infections. Bacteria can enter the middle ear through the ear canal and cause a middle ear abscess. Lung infections. Bacteria can enter the lungs and cause a lung abscess. Causes of abscesses. Gastrointestinal infections. Bacteria from the gastrointestinal tract can spread to the body and cause a liver abscess, a bile duct abscess, or an intestinal abscess. Symptoms of abscesses. The symptoms of an abscess depend on the location and severity of the infection. However, some common symptoms include: pain. The area of the abscess is often severely painful, swollen, and red. Swelling. The tissue around the infection swells, forming a hard lump that is painful to the touch. Symptoms of abscesses. Redness. The skin around the area of the abscess is often red and warm. Pus. Pus may drain from the abscess, especially when it ruptures. Fever. Fever is a sign of infection and often occurs with an abscess. Chills. The patient may experience chills and feel cold. Symptoms of abscesses. Fatigue. The patient may feel tired, weak, and have a loss of appetite. Diagnosis of abscesses. The diagnosis of an abscess is primarily based on clinical presentation. The doctor will rely on symptoms such as pain, swelling, redness, warmth, and pus to diagnose an abscess. Laboratory tests. Elevated white blood cell count, especially neutrophils, indicating the body's response to infection. Diagnosis of abscesses. Increased erythrocyte sedimentation rate (ESR) indicates inflammation in the body. Increased fibrinogen and globulin levels. These proteins participate in the inflammatory process. Diagnosis of abscesses. Bacterial or fungal cultures. If there is bacteremia, bacteria or fungi entering the bloodstream, a culture should be performed to identify the type of bacteria or fungus causing the infection. Elevated white blood cell count, especially neutrophils, indicating the body's response to infection. Diagnosis of abscesses. Increased erythrocyte sedimentation rate (ESR) indicates inflammation in the body. Increased fibrinogen and globulin levels. These proteins participate in the inflammatory process. Diagnosis of abscesses. Bacterial or fungal cultures. If there is bacteremia, bacteria or fungi entering the bloodstream, a culture should be performed to identify the type of bacteria or fungus causing the infection. Diagnosis of abscesses. Ultrasound used to determine the location and size of the abscess, especially for abscesses deep inside the muscles, thigh, lumbar, diaphragm and organs, liver, bile duct, lungs. Aspiration of pus from the abscess to perform bacterial culture to identify the infecting bacteria and drain the pus. Diagnosis of abscesses. Elevated white blood cell count, especially neutrophils, indicating the body's response to infection. Increased erythrocyte sedimentation rate (ESR) indicates inflammation in the body. Increased fibrinogen and globulin levels. These proteins participate in the inflammatory process. Diagnosis of abscesses. Bacterial or fungal cultures. If there is bacteremia, bacteria or fungi entering the bloodstream, a culture should be performed to identify the type of bacteria or fungus causing the infection. Principles of abscess treatment. The principles of abscess treatment depend on the severity and depth of the abscess. Small abscesses affecting only the skin. Pus may drain on its own, the abscess may shrink, dry up, and disappear, or antibiotics can be used to control the infection. Principles of abscess treatment. Large abscesses with deep pus accumulation. The doctor needs to incise, drain, and irrigate the abscess. Antibiotics should be prescribed to kill the bacteria causing the infection. Principles of abscess treatment. Symptomatic treatment. Symptoms such as fever, pain should be treated, and the patient's condition should be strengthened. Note: abscesses are infectious conditions that need to be treated promptly to prevent serious complications such as sepsis, spreading abscess, tissue necrosis, osteomyelitis, meningitis. Patients should see a doctor for prompt diagnosis and treatment. Note: patients should comply with the doctor's instructions on medication, wound care, and personal hygiene to prevent reinfection. Practice good personal hygiene, avoid contact with open wounds, use personal items, and get vaccinated against infectious diseases to prevent abscesses. Seeing a doctor for accurate diagnosis and treatment: you should see a doctor for prompt diagnosis and treatment.